Thank you, Mr. Chairman, and thank you to each of you for being here. Admiral Giroir, in your opening statement, you talked about the importance of protecting the elderly, which I think all of us would agree is critical, and yet the elderly have been impacted the most by this COVID-19. In New Hampshire, over 80% of our deaths from COVID-19 have been in long-term care facilities. That's why I am so concerned about the slow pace that HHS has provided in giving support for infection control in these facilities. The CARES Act provided up to $200 million for nursing home infection control efforts, and to date, only $17 million of that has been spent. On top of that, HHS has only spent about half of the $16 billion that Congress has provided for the acquisition of personal protective equipment, which continues to be a need. Nursing facilities and providers across the care system in New Hampshire desperately need these supplies. So, Admiral, the infection control funds are vital to helping our nursing homes reduce the spread of diseases. You alluded to that. So when can we expect the remaining funds to be distributed?
I can't answer that on that specific. I don't know when they will be distributed. What I can say is that I know even in the last couple of months, there's been $5 billion of extra funding to nursing homes. $2.5 billion of that is to support testing, which is really in our regime. And we do get Admiral Polubchak, the other admiral on the team with an unpronounceable name. So every day we get about 99% of nursing homes reporting, so we know exactly what their PPE situation is. So, but in terms of that specific fund, I'm going to have the team get back to you on that.
I would appreciate that. One of the challenges with that $5 billion that was just distributed is that it can only be used for hiring only, not retention. And the biggest challenge our nursing homes have in New Hampshire is retention of employees. So is there going to be any thought given to providing more flexibility for long-term care facilities and how those funds can be used?
And I'm really sorry. I'm going to have to get Seema Verma and the secretary to respond to that. That's not within my realm of responsibilities.
Well, I would urge you to do that, because if we're providing funds to long-term care facilities that can't be used, then it's not accomplishing the concern that all of us share. I want to go on to another issue, because there was a report that just came out about HHS seeking bids for a $250 million contract for a public relations campaign to defeat fear and inspire hope regarding the pandemic. And while I think all of us want to make sure that Americans know that there is going to be a better time ahead for us, the timing of this contract raises real concerns about the potential intersection with the president's reelection campaign, and more importantly, Congress didn't direct HHS to conduct this campaign. So is the $250 million that's going to that coming from funding that should be going out to our long-term care facilities, to our hospitals, to our medical providers to actually respond to the spread of COVID-19? And what is the purpose of this contract at this time to do a public relations campaign? Wouldn't it be better to give information to the American public about what all of you have said so eloquently this morning about what we need to do to respond to this virus and what we need to do to ensure that people have the health care they need if they contract it? Admiral, can you answer that?
And ma'am, I really do apologize, but I don't know anything about public affairs campaigns or where that money comes from or what it's going to do. That's just not something that I deal with. We all try to provide the best information we can through whatever vehicles we can, but I just don't know about public affairs contracts.
So you were not aware that the department is going to be spending $250 billion on that advertising campaign?
I mean, I'm generally aware from what I read in the news, but I'm really not involved in that. All I know about public affairs is that we do want to get all of us in front of the public to make sure, number one, they get their flu vaccines this year, because that's really critically very important.
Thank you. I think that's very helpful. Dr. Kadlec, were you aware of this expenditure?
No, ma'am.
Mr. Chairman, I would hope that this committee would ask some very tough questions about what's going on here, because that's a lot of money for a campaign that we ought to be spending to address this pandemic. And Senator Alexander, I totally agree with you on doing some work now to respond to the next pandemic, and I would suggest that we also ought to restore the Global Health Security and Biodefense Unit, either at the National Security Council or somewhere where it can provide an early warning for what's ahead. Thank you very much.
Thank you.